Hi, everyone. Thank you for being here, whether you're in person or online. We appreciate it. Forgive me, I'm gonna look at my notes more than I traditionally would because I have a sinus migraine that you wouldn't believe at the moment because it's January and it is what it is. So thank you for your grace in this moment. I could not have stood to miss it because we have been planning this for quite a while now, and we have a lot of folks registered, a lot of folks here, a lot of folks, I think, hungry for this information and this conversation. Thank you again, whether you're a resident of this community, a partner, a clinician, a prevention advocate, a survivor, a caregiver, someone experiencing cancer right now. Thank you for being here. If you're here, it's because you care. It's because you know somebody who's going through this. It's because you lost somebody and you're determined to carry their memory forward. It's because you're going through cancer and you need to feel the weight of hundreds of other people around you, reminding you that we are here with you, ready to spur action forward and to make some changes in Polk County to see some different cancer-related health outcomes. My name is Julianne Van Loo, and I have the very distinct honor of leading the Polk County Health Department. We've been anxious to help lead this conversation because you've all seen the headlines. You all know that cancer is among the leading, Iowa, is among the leading states in our continued rise in our rates of cancer. About 2,500 folks every year in Polk County will be diagnosed newly with cancer. And about 1 in 4 Polk County residents who die every year die by cancer. This is not something that is experienced in every county or every state across the nation. It's worse here in Polk County, it's worse here in Iowa, and today we're going to talk a little bit about why. So first and foremost, I want to give a very heartfelt thank you to the Harkin Institute for partnering with us to put this on here tonight. With the 99 counties project through the Iowa Cancer Registry. They're going to be the focus of our presentation tonight. To the Community Foundation for helping put together our poster hall, which demonstrates a lot of what is already happening. There is so much happening in Polk County already around cancer prevention and mitigation and survivorship. So thank you to everybody who helped make tonight possible. We know that here in Polk County, screening is delayed for cancer, and that cancer touches everyone across Polk County. But we also know that those delays in screening and the extent to which cancer affects us isn't experienced the same across our community. We have differential exposure, income, transportation, education, housing, environmental exposure, all of these social conditions that are leading to inequitable cancer-related health outcomes. For those who are low income, those in certain zip codes, those folks who, by and large, are communities of color. And so tonight, we want to make sure that we're taking a systems-wide approach. Tonight is not about blame. Tonight is not about individual choices. Tonight, we're going to talk about the data and the facts and the reality on the ground, and what we might be able to do moving forward to change systems and policies to eventually come to a place where we're not seeing the rates that we're seeing today. With that, I want to share a little bit more about what exactly you're going to hear tonight. First, in a moment, you're going to hear from the Harkin Institute as they kick us off here. But first, I want to remind you that we have a QR code up here. Please submit a question, because after we hear from our folks at the Iowa Cancer Registry, the bulk of this presentation, we're going to have a panel up here of experts and community members, and we're going to answer some questions that we have prepared and from you all. So throughout the presentation, please feel free to submit a question. That QR code will be up periodically throughout the slideshow. We want to make sure we're talking in our panel and in our closing session about the things that you're most interested in and the things that resonate with you. The stuff we can't get to, we will be sure to find answers for and to share out later. Okay, with that, I'm going to pause and give a special thanks again to the Harkin Institute for Public Policy and Citizen engagement, and ask Craig Owens, the Executive Director, to come and kick us off.
Thank you, Julianne. Good evening and welcome to Sheslow Auditorium on the campus of Drake University in Des Moines. Here at Drake, we strive to be a university of our place, and tonight's event is one testament to that aspiration. Whether that place is Dogtown in Des Moines, Polk County, the great state of Iowa, or the hundreds of locations around the nation and the world represented by our online attendees tonight, we're honored to be part of the many communities whose people give purpose to what we do. The Harkin Institute pursues a nonpartisan, progressive mission to connect people with policy and to connect policy to reliable, actionable data aligned with key priorities of retired Iowa Senator Tom Harkin's 40-year legislative legacy: disability access, retirement security, labor and employment, and of course, wellness, nutrition, and public health. Without question, tonight's event will bring that mission vividly to life. The Iowa Cancer Registry is leading conversations like this one across the state through its 99 Counties project. This work brings local-level cancer data directly to our communities, county by county, so leaders, partners, and residents can better understand where progress is happening, where gaps still remain, and where action can make the biggest difference. Thank you to the Iowa Cancer Registry and its many partners for making these conversations possible. And a word of thanks to the Harkin Institute's many supporters whose gifts, large and small, continue to enable programming like this. Our work is supported almost entirely by donors who see and value the impact in their lives and their communities, and we deeply, deeply appreciate their generosity. Speaking of programming, flyers calling attention to this year's Harkin on Wellness Summit are available for you to pick up here this evening. The event, which takes place in the Olmsted Center here on Drake's campus on April 14th, will focus on the treatment and prevention of cancer. I hope to see you there. Now, we're pleased to be joined by two leaders from the Iowa Cancer Registry who are here to help ground tonight's conversation in data, and just as important, to help us understand what that data means for our community. First, Mary Charlton, PhD, is the director of the Iowa Cancer Registry and a professor of epidemiology at the University of Iowa College of Public Health. Mary leads the work behind Iowa's cancer surveillance efforts and helps translate cancer data into insight, looking at trends, risk factors, and outcomes to inform prevention, early detection, and care across the state. She's joined by Whitney Zond, PhD, assistant professor in the University of Iowa's Department of Health Management and Policy, and past president of the Iowa Rural Health Association. Whitney's work focuses on understanding how place and access shape cancer outcomes, especially for Iowans outside of urban areas. And in appreciation of their choosing the Harkin Institute and Drake University tonight as a venue for this event, I'm going to confer upon them when they come to the stage one of these snazzy Harkin Institute lapel pins as a token of our appreciation, highly coveted, and I hasten to add, bipartisan lapel pins so you can wear them in mixed company. So please join me in welcoming Dr. Charlton and Dr. Zahn to the conversation.
Wow, thank you all so much for being here, and a huge thanks to Drake University for hosting us here. As you'll learn from the data that I'm going to present, it's going to take all of us, and we really appreciate our other university partners across the state and all of you who have come here today to listen and hear and think about and brainstorm what we can be doing to address Iowa's high cancer rate. Oh, we already got that great introduction. Because I have two microphones on. Better? Okay. Okay, just a reminder that these slides will be posted to the Iowa Cancer Registry website after this presentation. There's a website there. If you have questions, we'd love to hear them. And there'll also be a survey at the end. You'll get it if you registered. You also will show a QR code. You are county number 45, so we still have a long way to go, and we can make a lot of improvements in the back half. So we really appreciate the feedback that we get from people who attend these meetings. And here's that QR code, and you can use that to submit questions during the presentation. First, I want to acknowledge our partners, aside again from the gracious hosting by Drake University. The 99 Counties project team includes the Iowa Cancer Registry, the Iowa Cancer Consortium, the Iowa Rural Health Association, the Holding Comprehensive Cancer Center at the University of Iowa, and our partners at Iowa Health and Human Services. We start all of our presentations at the registry by acknowledging this quote that statistics are people with the tears wiped away. We're going to throw a lot of numbers at you, and so we want to acknowledge that all these numbers represent people. They are our loved ones that have gone through cancer and have died from cancer and are unfortunately experiencing very high rates of cancer. They are all our fellow Iowans. No doubt you're all here because you already know that Iowa has the second highest rate of new cancers in the U.S. Our rate is about 14% higher than the rest of the United States. Fortunately, I say that word just because it's best not to be number 2. We are number 23 in terms of having the highest rate of cancer deaths in the United States. So very close to average, but our rate is still 3% higher than the US rate. Over half of Iowa's counties have a significantly higher incidence rate than the rest of the US. 59 counties have a rate over the national average. We only have 1 county in the entire state with a rate below the national average. So just a little bit of background about the project. Our goal is to enhance community engagement and education around cancer prevention and control across all of Iowa's 99 counties. We want to present county-specific data, listen to your questions and concerns, provide resources, and recommend some actions that can be taken. It's a really busy slide, but it's meant to show how many cancer control partners there are across the state. On the left-hand side, we have the state government, our elected governor and Iowa legislature, who propose and vote on legislation. Then we also have, again, our partners at Iowa Health and Human Services, and that includes the Comprehensive Cancer Control Program, but it also includes things like the Bureau of Environmental Health Services and local county public health services and boards of health. On the right-hand side, we have all of our provider partners who provide cancer prevention, screening, treatment, and survivorship services to Iowans with cancer. The Iowa Cancer Consortium, which I'll talk about quite a bit later. The American Cancer Society with the Iowa Cancer Action Network that advocate for cancer-relevant policies. We have the University of Iowa Holding Comprehensive Cancer Center, our only NCI-designated cancer center in Iowa. The Iowa Cancer Registry. And then of particular interest to a lot of people are some university research centers like the Center for Health Effects of Environmental Contamination, which I'll be talking about more later. Also want to talk about a little background about the Iowa Cancer Registry, our goals and our scope. Our goals are to assemble and report data on new cancers, cancer deaths, and survival, to respond to data requests from organizations and individuals, and support studies for cancer prevention, research, and education. We are a surveillance operation at the registry. We are not a research organization, and we are not an advocacy organization. But we want to put credible data out there for all of those of you who are part of those organizations. We are here for you to provide and be your go-to source of reliable cancer information in the state of Iowa. We want to acknowledge our funding. A large part of our operation is funded by the National Cancer Institute. The Cancer in Iowa 99 Counties project is specifically funded through a grant through the National Cancer Institute. It is also now supported by some very generous philanthropic donations that we've received at the registry. The Iowa Cancer Consortium acknowledges the Centers for Disease Control and Prevention for its funding support. And the contents of this presentation are solely the responsibility of the authors and do not represent the views of the CDC or the National Institutes of Health. Okay, so a little bit of background on cancer before we get into the numbers. As most of you know, cancer is complicated. We all want to reduce it down to one thing. We would all love for it to be one thing that we could fix, but there is no one cause of cancer. It is a combination of different genetic, lifestyle, and environmental risk factors that change the function of our cells. Risk factors are things that increase your chances of getting cancer. When we talk about lifestyle factors, we're talking about things like alcohol, tobacco, unhealthy diet, not being physically active, and sunburns. When we talk about genetics, we're talking about family history of cancer or random mutations. When we talk about the environment, we mean exposure to chemicals or radiation. And there's a lot of other factors, such as just aging increases your risk for cancer, as do viruses such as HPV and hepatitis B, and medical conditions like chronic inflammation. All of these risk factors work together to contribute to cancer. Not one of them causes cancer on its own. We all know people who smoked their entire lives and never got lung cancer, and we all unfortunately probably know people who never smoked and still got lung cancer. It's always that complicated, even with something like smoking. I want to address up front that many Iowans understandably have a lot of questions about potential links between environmental exposures and cancer. This is a very important area of continued research, and Iowans are right to ask questions. But just to level set, the Iowa Cancer Registry, along with all other population-based cancer registries, do not collect data on environmental risk factors. But we do share our data with researchers to support studies of cancer and environmental risk factors. One example I'll talk about later is the agricultural health study. That's a large cohort of over 30,000 farmers in Iowa who they followed through time, and the Iowa Cancer Registry provides the data to that study so that they know which members of their cohort got cancer, so they can study things like pesticides, nitrates, and other things like that. One thing that makes kind of figuring out what's causing all the cancer really tricky is that there can be, and often is, many years between exposure to risk factors and cancer development, which makes it very difficult to prove connections. Again, for example, lung cancer may not occur until 30 years after a person starts smoking. Also, when we talk about things like water quality, there is no record of all the different places that all of you have gotten your drinking water from over the course of your entire lives. So what may be in your drinking water now may not necessarily be causing cancer now. It may have been things over the course of decades. Today, we are going to focus on things that you can do to reduce your cancer risk. These things can be addressed at the state, community, and individual levels. While individual choice is very important, and we're going to talk about some things that you can do as individuals, leaving it up to individuals to do the right thing and to do the healthy thing is what got us to be the second highest state with the second highest cancer incidence rate in the country. We need stronger policies and programs that make it easier to do the healthier things and harder to do the unhealthier things. So we'll be talking about that. But we will talk about some things that you can do at individual levels also. Just a few key terms before Whitney takes over with the data. When we talk about cancer incidence, that's the number of new cases of cancer occurring during a specified time period in a population. When we talk about mortality, that's the number of deaths from cancer that occur during a specified time period in a population. Counts, of course, the number of new cases or deaths from cancer. But mostly what we'll be presenting to you are age-adjusted rates, which address the question, if the size and age of the populations were the same, would there be a difference in the rates? A lot of times people ask us questions like, well, Iowa should have a higher cancer rate because we're older. but our data, like, we're adjusting for that so that age isn't a factor. We do that by forcing the age distributions of all the populations that we're comparing to be the same, and then we apply our Iowa or county-specific cancer rates. This adjusts the counts to give a per 100,000 population, so we can be comparing apples to apples when we compare Polk County to the state and to the United States, or I'm sorry, Polk County to the state of Iowa and to the rest of the United States. We'll be talking about stage, and for the purposes of this presentation, when we say early stage, that means a localized cancer where the cancer is limited to the place where it started with no sign that it has spread. And when we talk about late stage, we're talking about regional spread, or that cancer has spread to nearby lymph nodes, tissues, or organs, or that cancer has spread to distant parts of the body, or in other words, metastatic cancer. And finally, these look like the graphs that Whitney is going to go over. The black lines on these graphs represent the United States. The bars will represent Polk County. When the bars are teal, or that turquoise color, which unfortunately not very many of them are, that means that you're significantly below national rates. When they're gray, you're about the same as national rates, and when they're that dark blue, you're above, significantly above national rates. Those gray boxes represent 95% confidence intervals, which means 95 times out of 100, the true value lies within that box. And when that box does not overlap with the black line, that means there's a significant difference. But Whitney will walk you through all that. And with that, I'll turn it over to her.
All right, thank you very much, Mary. I'm going to be walking through, as she said, the cancer rates in Polk County and some breakdowns of those data. So when we put Polk County in the context of counties that are metropolitan or urban in nature, you see that the county ranks 11 out of 22 counties when it comes to incidence rates for cancer overall, just about 497.8 per 100,000. Again, these are age adjusted that we are sharing. So this amounts to around 2,600 new cancer cases on average each year in Polk County. As we've shared previously, this is higher than the U.S. average across the board, and about middle of the pack when it comes to all Iowa counties. When we have this broken down by male and female, both sexes are above the national average for cancer incidence. We'll be sharing also some numbers by race ethnicity, and so you can see these are the incidence rates of new cancer rates by race and ethnicity within Polk County. You can see for non-Hispanic Black individuals, non-Hispanic white, and Asian Pacific Islander populations, all of these are above the national average, as you can see with the darker blue color, and then for Hispanic individuals, the rate is about the same as Hispanics throughout the country. So all these that will show any racial ethnic comparisons are compared to the rate nationally among the same race or ethnic group. This shows the rates broken down also by race, ethnicity, and sex. And so we can see for non-Hispanic Black, non-Hispanic white, and Asian Pacific Islander male, those rates are all higher than the national rate overall. And you can see, particularly for non-Hispanic Black men, the rate is the highest among all of those sex and race ethnicity breakdowns. When we talk about cancer deaths here in Polk County, there are about 827 deaths on average per year. This is also higher than the U.S. average and about ranked 37 out of our 99 counties. We can see here that for both male and female, these rates are higher than the national average as well. Again, looking at cancer deaths by race and ethnicity, non-Hispanic Black, Asian Pacific Islander, and non-Hispanic White have higher cancer death rates than their peers nationally, and non-Hispanic Black individuals have the highest rate in the county. And breaking this down by race, ethnicity, and sex, we also see higher rates among non-Hispanic Black men, non-Hispanic Black women, non-Hispanic white males, and Asian Pacific Islanders for both men and women. One thing that we want to bring to highlight, even though much of what we're talking about is largely adult cancers, we know how important it is to also look at cancers among children, adolescents, and young adults, and want to share some of those numbers because those are more rare, thankfully. Often the numbers are too low to present more localized or county level data, so what we're sharing here is statewide. So we can see here that our rates are relatively similar to the US when it comes to those under the age of 15, ages 15 to 19. But we also, at the same time, we have a little bit higher rate of young adult cancer here in Iowa for those between the ages of 20 and 39 compared to the US. So the remainder of this data portion will be focusing on the top 5 cancers here in Polk County. So you can see that the top 5 here: female breast, prostate, lung, colorectal, and then endometrial or uterine cancer are our top 5 here in Polk County. You can see 3 of these are higher than the national average, so female breast, lung, and endometrial. And you can see how this ranks throughout the state of Iowa. One thing that I will highlight, you can see the rankings for each individual cancer. You'll notice that a few of these are out of fewer number of counties, not out of the full 99. That is simply because some counties are pretty small and have too few cases for us to calculate a statistically stable rate. So you'll see that a little bit with some of those, just to put that in perspective. But we'll be talking a little bit through each of these 5 different cancer types. So we look at female breast cancer. You can see in Polk County the rate is higher again than we see nationally. Nearly 400 new cases per year of female breast cancer here in Polk County, and about 54 deaths on average. That rate is about the same, that death rate is about the same as we see nationally, however. We look at this by race and ethnicity. You can see that for Asian Pacific Islanders, this is one where the rate is lower than what we see nationally, while for Black and Hispanic women, it's about the same as the national rate, and we see a higher incident rate for white women here in Polk County. For cancer deaths, you can see how that breakdown, for some of these, the rates there's too few cases to calculate those stable rates by the racial ethnic groups, but we see that for Black and white women, the rates are similar to the nation as a whole. So look at, and we'll be talking, as Mary said, some of these things that we'll be sharing are a little bit on what can we do as individuals to help either reduce our risk or help identify cancer early. So I'll be sharing some of those things we all can do, and then Mary will also be sharing more on, like what she was saying, what are the things collectively, or what are the policy steps that can be taken to address these. But one of the things that's going to be important as we talk about some of these cancers is screening, of course. So when we look at the percentage of women over the age of 50 up to date with screening, we see that Polk County is right around the US and statewide percentages. Of course, we want to see all of those increase. You'll see here with some of these screening rates, the Iowa Cancer Plan goal is to get that up above 81%. But it's screening is a way to identify, detect cancer early when it is more treatable. So we encourage folks, women who are ages 40 to 74, to get a screening with a mammogram every 2 years, and to have that conversation with your doctor about family history as well. So as Mary said, we're going to be presenting some data on by stage, so you can see how this breaks down across race, ethnicity. In Polk County, you see higher percentages of late-stage breast cancer among Black and Hispanic women compared to countywide. We see that late-stage rate is about 31%, where we see higher rates, again, among Black and Hispanic women when it comes to the percent diagnosed at a later stage. One of the things we want to highlight is the Care for Yourself Breast and Cervical Cancer Program as a program through the Iowa Department of Health and Human Services that provides free breast and cervical cancer screening across the state, serving women aged 21 to 64 who meet certain criteria. So encourage folks to connect with that resource if you're eligible, or to be able to share that information with others. The second highest cancer rate in Polk County is prostate cancer. We see that one, both for incident rate and death rate, is about the same as the US average. Over 291 new cases on average per year, 41 deaths for prostate cancer. See this broken down by rates of new cases. You can see for Asian Pacific Islander, Hispanic, and white, the rates are lower than we see nationally. Unfortunately, and very starkly, we see a very high rate of prostate cancer among Black men here in Polk County, and similarly a high mortality rate for prostate cancer, whereas other groups either have too few cases to show rates, or a rate that's about the same as the US rate. So prostate cancer, there is a screening test, the PSA test, that is, you can see two different types of organizations making some recommendations on this. So the United States Preventive Services Task Force encourages conversations for men to have with their physician to discuss if a PSA test is appropriate for you. The American Cancer Society has a set of recommendations that are broken down a little bit more by age and risk. So please take a look at those and have that conversation with your physician on what is best for you based upon your risk and your age. Again, showing the rates, stage percentages by race and ethnicity. We see, again, a little bit higher percent of late-stage cancers, prostate cancers among Black men, and you can see how this breaks down by race and ethnicity, as well as the overall county rate, about 27% being diagnosed at a late stage, compared to about a fourth of those statewide. Lung cancer, this is one that is the third highest, most incident cancer here in Polk County. Both the incidence and mortality rate here in the county are higher than we see nationally, about 330 new cases annually and just over 200 deaths. And see this broken down by incidence and mortality rates. We see for both Black and white individuals, both of those rates for incidence and mortality are higher than the national average for lung cancer. Lung cancer, this is a screening that is relatively new compared to things like mammography or colorectal cancer screening. So our screening rates are a lot lower, and so there's really an opportunity to make sure that folks who are eligible or recommended for that kind of screening have that screening. So this is recommended for folks based upon their age and their smoking history, how long they've smoked, do they currently smoke, how much have they smoked. So that information is important to explore as well. And when we look at this broken down by stage of diagnosis, lung cancer looks different than what we see for some other cancers that are more detectable earlier. So we see kind of across the board about 3/4 or more of lung cancers are diagnosed at a late stage. That really is where screening can help come in and hopefully identify that earlier where it is more treatable. Lung cancer, another important thing, of course, we are typically all familiar with smoking playing a big role in lung cancer, but radon is another important factor, and the second leading cause of lung cancer and the first leading cause among folks who are not smokers. And we also see that combination of both smoking and radon exposure putting smokers at particularly high risk of developing lung cancer. So we encourage folks to connect with Iowa Health and Human Services, the Iowa Cancer Consortium, for more information about testing and mitigating for lung cancer. This is an opportunity to reduce our risk in our homes, so we encourage folks to connect there, and more information available there. The fourth most, the highest rate of cancers are colorectal cancers. This is about the same as we see nationally, both for incidence and mortality, about 188 cases on average and 69 deaths per year for colorectal cancer. We see this broken down by incidence and mortality. Again, for Black individuals, the rate is higher than we see nationally, both for incidence and mortality, whereas for other groups, it's about the same as we see nationally. Colorectal cancer screening, this is one that across this state, we have an opportunity to increase our screening rates for folks 45 to 75 for whom this screening is recommended. So we encourage people to either get an at-home stool test, get a colonoscopy, have a conversation with your doctor about which screening is best for you. Also, again, want to highlight staging. So this is one where we're seeing over half of individuals, regardless of race or ethnicity, are being diagnosed at a late stage. We see this is one where Asian Pacific Islander and Hispanic individuals have a higher rate of late stage. We see a little bit lower late stage rate among Black individuals that we see for other cancers, but again, an opportunity for screening to play an important role to reduce that late stage rate. Also want to highlight another program, the Iowa Get Screened program for colorectal cancer screening. This is Department of Health and Human Services partnering with federally qualified health centers to provide increased colorectal cancer screening. So I want to share that program as well. The fifth most incident cancer is endometrial uterine cancer, just under 100 cases on average per year, about 20 deaths. And again, this is one where we're seeing a higher incidence and mortality rate compared to the national average. This is a cancer that does not have an explicit screening modality, but it's one we encourage folks to keep an eye out if have potential symptoms, vaginal bleeding or discharge, not related to periods, after menopause, and several other symptoms that may indicate abnormality to have that to have that discussion with your doctor if you experience those. And this is one where about a fourth of individuals are diagnosed at a late stage for this cancer. Again, the earlier we can detect it, the better the survival. So I'm going to hand it back to Mary to talk more about some more broken down geographic data and some resources as well.
Thank you, Whitney, for all that data. As you can see, there's some really stark contrasts and some disparities in terms of cancer incidence and mortality by race. Also, some troubling cancers. You don't want to be significantly higher than the rest of the country, particularly in lung cancer. That accounts for about 25% of all cancer deaths, so that is not a good one. Not that there is a good one, but that's a particularly bad one to be ranked highly in. This is something special that we put in for your presentation. We usually can't do this with most of our rural counties. We're usually trying to combine counties together so that we can get stable rates. But given the size of the population here in Polk County, we're able to start to cut this apart into your different communities. So I think we worked with maybe a couple public health directors before for Julianne to come up with these different zones. We call them cancer reporting zones. They're on our website and they're going to be updated when we release the Cancer in Iowa report for 2026 at the end of February. Basically zone 3 in the middle, you can see that's where we're at right now. And then the different zones, kind of the surrounding areas around Des Moines. The purple means the highest rates of cancer, and the yellow is the lowest rates of cancer. So when we look at overall cancer incidence rates, you can see some very different patterns, just even within Polk County, how those look very different. Then when we break it down to the different types of cancer that Whitney covered, you can see the patterns vary by cancer type. So breast cancer being higher in those outerlying areas of Polk County and lower in where we're at now and kind of surrounding downtown Des Moines. Similar pattern for prostate cancer. Opposite pattern for lung cancer, where now you see some of the higher rates in downtown Des Moines and the southeastern part of Polk County with the lower rates in those western areas, western and northern areas. Colorectal cancer, a little bit different still, with kind of skewed with higher rates towards the eastern part, including downtown Des Moines. And then endometrial, a little bit different. So you can see, even within Polk County, the patterns change by the type of cancer that you're looking at. And you could see from what Whitney presented, even within a population, rates differ by things like race. So how can you reduce your risk factors for cancer? So this is going to be the part about individual behaviors. Again, we're talking about these risk factors. You can do everything right and still get cancer. That's the maddening part of all of this. But we do know from looking at populations that certain risk factors are associated with higher rates and certain protective factors are associated with lower rates. So this is, again, not to blame anybody who's sitting here who has had cancer and has not done any of these things. It's just to show the sort of grouping of risk factors that can impact a county or a population's cancer rates. We know that about 40% of cancers in the US are attributable to modifiable risk factors like smoking, alcohol, diet, infections, etc. Obviously, you wouldn't think I would have to say it, but do not smoke or use any form of tobacco, make your home smoke-free. As I'm about to say a few slides later, we still have almost 15% of people in Polk County who are still smoking. Also, if you probably noticed, our kids are getting addicted to weird new nicotine products, a new one every day, which may in and of themselves, these different products, not be as dangerous and as high risk for cancer as smoking, but they often can lead down the path towards smoking because they're getting our youth addicted to nicotine. Limit alcohol consumption. This is not a popular one to talk about, and still feeling some backlash of our 2024 Cancer in Iowa report about alcohol. It is a very common exposure. As we did not say in the Cancer in Iowa report, we're not saying that it's causing all the cancer in Iowa. We're saying that it's an important contributor. It combines with other risk factors to increase our risk for cancer. Again, you can not drink at all and still end up with some types of cancer for sure. But after writing that report, I know for my own sort of strategy, I read a lot about, that there are social benefits of alcohol. Everybody likes to celebrate or go out and have dinner. There are really benefits. Some of the world's greatest problems probably got solved over a round of beers in a tavern. So not to say that you have to cut out all alcohol. But what I realized I was doing for myself was using it as a reward to do emails or work late at night. I would have a glass of wine while I was doing that. I'm getting no benefit from drinking by myself. So that is one thing you can possibly implement for those of you who do that. Probably most of you don't, but if any of you are like me, maybe cut back on drinking by yourself. You're not getting any benefits whatsoever. Reduce indoor and outdoor air pollution. That includes radon, which I'll talk more about. Enjoy a healthy diet. That and being physically active are incredibly important. Those work together to protect you from cancer. Fruits and vegetables have a lot of important antioxidants in there that can repair cell damage that you've been exposed to. So those are hugely important. Decrease excess body weight. That, boy, if it were only that easy to say that. But again, I think the path to more protective factors are to focus on enjoying a healthy diet with fruits and vegetables and being physically active. Avoid too much sun. Use sun protection. Melanoma didn't come up in your top 5, but it was close, and it comes up in most counties' top 5. We have one of the highest cancer melanoma rates in the country, even higher than states like Florida or California in the Sun Belt. Vaccinate against hepatitis B and HPV. That's still very important. Those are the only cancer prevention vaccines that we have, and they're still incredibly important to get, and to get the appropriate cancer screenings for you. Again, another note about a vaccine that prevents cancer, which would be the HPV vaccine. We only have, in Polk County, you're doing pretty well compared to the state. 62% of eligible adolescents ages 13 to 15 have completed their HPV vaccination series. Iowa has the highest rate of oropharyngeal cancer in the country. That's head and neck cancer. It's a terrible cancer. I'm sure Dr. Deming and all the providers in here could tell you. It is the worst. They put this horrible thing on top of you, don't you, to like pin them down, to aim this radiation, right? Like it messes up your teeth. You might never eat a steak again. It messes up your saliva glands. It's a terrible, absolutely terrible cancer to get, and unfortunately it comes back a lot. That's when it's completely preventable, well, not completely, I shouldn't say that, but it's largely preventable with an HPV vaccine. Something like cervical cancer is completely almost preventable by getting the HPV vaccine. It's one of the most effective cancer prevention paths that we have, so very important to get our adolescents vaccinated. And people, I think, don't like talking about their 11 or 12-year-olds or 9 through 12-year-olds ever having sex. But the point of this is their immune systems at that age are the perfect age to uptake the vaccine. That is when it will convey the most protection for them, and it's before they're ever exposed. So it's really important to get that age group vaccinated. Okay, a note about the tobacco tax. After the last tobacco tax was passed, way back in 2007, smoking rates decreased in 92% of Iowa's counties, and Polk County is no exception. Oops, sorry, went the wrong way here. Now, because you're so populated, you sort of drive a lot of the rates that we show here, but you can see that there was a large decrease as that tobacco tax was passed. A lot of the counties that I'm visiting, they're actually starting to tick up in their smoking rates. And one study projected that Iowa will have one of the highest rates of smoking in the country by 2030 if we don't do anything. Tobacco taxes work the best when you do them every so often, like more than once every 20 years. So it's really important for us to consider raising the tobacco tax. It's the most evidence-based, single most effective intervention you can do to prevent cancer. Other risk factors to talk about, we have more than 1 in 5, or 21% of people in Polk County reporting binge drinking in the last 30 days, which is very close to the statewide average, which you can see is much higher than the rest of the US. We've talked about smoking, almost 15%. No leisure time activity. That means absolutely no physical activity outside of your job, and we have almost 1/4 of Iowans reporting. None physical activity outside of their job. We also only have about, I think, not even 1/4 that even approach the actual guidelines for physical activity. It's so important. It's like another key preventive factor is to get to be active. Our obesity rates are high at 37% compared to the rest of the US at 33%. And there are many, unfortunately, many obesity-related cancers. The American Cancer Society's risk factor assessment can help you learn more about what factors might affect your personal cancer risk and actions you can take to lower your risk. So this will be in the slides that we post after the presentation. And now just a few words about resources to help understand and address cancer in Iowa communities. The Iowa Comprehensive Cancer Control Program, run by the Iowa Health and Human Services, works with partners to prevent cancer whenever possible and support cancer survivors across Iowa. There's also the Iowa Cancer Consortium, which is our state's cancer coalition, with a mission to advance cancer prevention and control through advocacy, equity, and collaboration. It's a great organization. Just to get the email updates are amazing. They help facilitate connections and partnership, provide the latest news and cancer updates via email. There's a lot of training and educational opportunities, grant opportunities and technical assistance, free educational materials for distribution, lots of online work groups, and they help administer our Iowa Cancer Plan, which is one of the best in the nation. It's one of the envy of all states. And if we just did it, I promise it would work. So that's something to familiarize yourself with. You don't have to reinvent the wheel. All the evidence-based policies and programs are already laid out for you in that plan. And it covers things like prevention and risk reduction, early detection and screening, diagnosis and cancer-directed therapy, all the way through survivorship and end-of-life care. There is a lot we know about how to reduce our personal cancer risk, and there's opportunity for the biggest impact when policies help us do that. Again, to make the healthy choice easier, make the unhealthy choice harder, and to provide protections from risk factors that are out of an individual's control. Some policy examples that we think could really help address the cancer burden in Iowa. I've already mentioned that increasing the tobacco tax by at least $1 is the single most effective thing we could do, especially to reduce lung cancer, but a number of other cancers, and not just cancer, heart disease, stroke, you name it. We could impact that and lower those rates. Raise taxes on alcohol or set minimum unit prices. The example that somebody explained to me is that I think you can buy Hawkeye vodka for $14.99, and if you do the math on the number of servings, which is not easy because the alcohol lobby has prevented them from having to put the number of servings on the bottle, but if you do the calculations and measure it out, you can get a full serving of alcohol for 30 cents. There's not much else you can get for 30 cents, and why would we be allowing people to sell alcohol in bulk at that unit price? So other geographic areas have tried some innovative strategies of setting it at something like 50 cents. You cannot buy a unit of alcohol for less than 50 cents. That would probably not impact most of us who are occasional or social drinkers, but it would probably impact people who are drinking heavily every day, and those are the people, in fact, that we want to feel that minimum unit price. As I always say at all of these, we don't let our minors drink and we don't let our minors smoke. Why do we let them cook themselves in the tanning beds to their heart's content? We are one of the only states in the country that has 0 restrictions on minors' use of tanning beds. We didn't have the slide in here because melanoma wasn't in your top 5, but one of our colleagues pointed out a recent study that shows just going out into the sun, which is what the tanning bed lobby will tell you, is a reason why it doesn't make sense to restrict minors' use of tanning beds because they can just go outside. But studies have shown it's not the same. The UV radiation you get from tanning beds is way more intense, and it really significantly impacts your risk of cancer, especially for our young people who their frontal lobes are not fully formed and they cannot see the consequences of their actions. I have given some of these talks while I see my 18-year-old daughter out on the porch slathering herself and laying out. They don't understand what they're doing. So we should have policies in place that protect them from doing things that might bring them lots of melanoma in their future. Implementing tobacco and nicotine-free policies. I know at least in Johnson County, they've done some really interesting things about zoning restrictions to prohibit tobacco shops from operating near schools or other tobacco retailers, setting and enforcing limits on the number of places that sell alcohol and the distance between them, also reducing out-of-pocket costs for smoking cessation treatments and really promoting smoking cessation, and building communities that provide natural opportunity for physical activity, which I know Des Moines was great for. I miss running around Grays Lake with my Wellmark friends that I used to work with. Ensuring access to affordable fresh food, providing sunscreen and UV safety education, engaging community health workers, developing clinic-specific interventions, and supporting care navigation. That can be hugely important and beneficial, especially for some of the populations we talked about, which have very high disparities, high mortality, and certain types of cancer. and including cancer-relevant strategies in your hospitals or county's community health needs assessment or public health department's needs assessment. Those are just some examples. There's lots of ways to get involved. The American Cancer Society Cancer Action Network is sort of the lobbying arm that work to promote cancer-relevant legislation. And also, please get loud with your legislators. Please let them know what you would like to see happen here in Iowa. We know that every community is different. Your expertise as a community members and leaders and local policymakers is key to answering the question of what to do next. But know that cancer control partners like the registry, like the Iowa Cancer Consortium can help. We can help provide ideas, advice, and help find data, evidence, and other resources. So a good place to start is by taking stock of the information presented today. Use the Iowa Cancer Plan for inspiration, and please reach out to the Iowa Cancer Consortium for partnership moving forward. This is meant to be the beginning of a conversation and not the end. This is just meant to start and help start momentum here in Polk County. You have lots of resources. It's so great. There's 3 slides of resources. Usually for these little rural counties that we go to, it's like pulling teeth to get any that we can put on there about maybe well testing and radon testing. But it's amazing what you have available here. Black Women for Healthy Living, Children's Cancer Connection, Bras for the Cause, My City, My Health Prostate Cancer Initiative, Can Do Cancer, Polk County Health Department Ribbons of Hope program. All of this will be in the slides that we post after the presentation. Above and Beyond Cancer, which is near and dear to my heart since Dr. Deming let me join them for a Patagonia trip last year, trying to talk me into one this year that I'd love to go on. John Stoddard Cancer Center, Iowa Healthcare Mission Cancer and Blood, Mercy One Des Moines Foundation. And also the Healthy Estate Initiative, the Iowa Environmental Council, which I know partners with Drake University, and are creating a report that we're all looking forward to seeing. The Iowa Cancer Consortium, the American Lung Association, and the Iowa Rural Health Association. Again, all of this will be in our resource guide, which is posted after the presentation. But in the last few slides, I just want to highlight some things that may be of interest, like cancer cluster concerns, the agricultural health study, and some other environmental exposures that I know a lot of people that are on top of mind for people. If you suspect a cancer cluster in your community or anywhere in Iowa, please let us know at the Cancer Registry. We will talk to you about the location and types of exposures of concern, and we'll conduct an analysis of that area compared to another comparable area, theoretically without the exposure of concern, and do some comparisons to see if anything looks out of whack. A meeting will be held to discuss the results. Again, the agricultural health study is a really important cohort study run out of the National Cancer Institute that includes over 31,000 private pesticide applicators or farmers and their spouses. That will be the topic of the 2026 Cancer in Iowa report released in February. Our partners at the Environmental Health Sciences Research Center have created some environmental exposures and health risk fact sheets for people. And those include arsenic, atrazine, glyphosate, nitrate, radon, PFAS, and I don't know what TCE stands for. But they also take input, so if there's any chemicals you'd like to see, please let me know. Also want to point out the Iowa Private Well Grants Program. For those of you on private wells, very important to get your private wells tested for those analytes listed on the right. And again, I know of particular concern here in this area is water quality. Our partners at the University of Iowa Center for Health Effects of Environmental Contamination are a great resource. They support and conduct research to identify, measure, and study adverse health outcomes related to exposure to environmental toxins. I know there's also a lot of great resources here at Drake, which I think we have in a slide coming up after this one. This one is to point out the Center for Energy and Environmental Education's Environmental Health Program at the University of Northern Iowa. They highlight upstream solutions to protect children, climate, and health, and raise awareness about the link between harmful chemicals and their impacts to people and climate. Drake and the Iowa Environmental Council and the Harkin Institute are exploring the relationship between environmental risk factors and cancer rates in Iowa. And we'll be releasing a report, I think, soon. The University of Iowa Holding Comprehensive Cancer Center assembled an expert panel. It was a panel of experts from not just the US, but international experts as well. It was so interesting to hear their take on, I went through our data, kind of like I did with you for the state of Iowa, and really hear what their concerns were and what their ideas were. It was also really interesting to see, like, they were all thought this was so novel, like they'd never been asked to do this before, to really focus on a state's cancer burden, and kind of got to a couple people who had declined at the beginning to participate once they heard who else was participating wanted back in. So we are being advised through Holden by some great experts in terms of where we can look and what we need to think about. And then the Iowa Health and Human Services, through Governor Reynolds' recommendation, the legislature passed Senate File 647, which created a collaborative project with Iowa Health and Human Services and the University of Iowa College of Public Health to examine the factors behind the rise in cancer rates in Iowa. We're currently working on finalizing the interim report for that, which we'll be sending over to the state either at the end of this month or beginning of February. So our main takeaways is that cancer is a very important health issue facing your county. There are proven ways to prevent cancer and find it early. You can avoid risk factors and get screened. Also, though, it's important to make policy changes at local and state levels, which can have a huge impact. The Iowa Cancer Plan can help with that. Please communicate your concerns and needs with your state representatives and local policymakers. And remember that this is only the first step. Thank you so much for attending. Again, here's this QR code for the survey, and you also will be getting it via email also. So thank you.
Thank you, Mary and Whitney and the whole 99 Counties team. That was excellent. I'd like to go ahead and invite up our panelists up to the stage. I'm going to give a few reminders as they're making their way up. Please come join us. Thank you. Wow, that was really good. It's a little overwhelming, right? There's a lot of horrible information we just digested, but also a lot of opportunity for moving forward in terms of screening and testing, and also leveraging so much of what's going on around us. I think there's real power in events like tonight because they help create a shared understanding. It's hard to move forward and create a shared vision for the future without a shared understanding of what the problem is in front of us today. And I think we're really making progress towards that through all the information we just learned. So thank you so much. I'm really grateful to these panelists because you're going to hear a range of perspectives this evening. Clinical, community, data, and policy, all focused on our shared goal of improving health outcomes here in Polk County. So we have a few questions we're going to go through, and then we're going to ask them some of the questions you all have submitted. We've gotten many, thank you. Good participation, everyone. But before we do that, I want to introduce our panelists. I'll have you kind of wave as we go down. First, we have Dr. Richard Deming, Medical Director of Mercy One, Richard Deming Cancer Center in Des Moines, and founder of Above and Beyond Cancer. Dr. Deming is widely known not only for his leadership in cancer care, but for the compassion he brings to his patients and his families. He's been recognized nationally for his advocacy and commitment to human dignity, and many in our community know him as someone who never loses sight of the person behind the diagnosis. We're grateful to have you. Next, we're joined by Reverend Vivian Bryson, the Community Engagement Officer for Black Women for Healthy Living. Vivian works to empower and mobilize Black women in the greater Des Moines community to prioritize their health, self-care, and wellness. She is an ordained minister, and she is also a breast cancer survivor. Vivian leads a breast cancer support group for women of color where she walks alongside them throughout their cancer journeys. Thank you, Vivian. We're also joined by Adam Shriver, Director of Wellness and Nutrition Policy at the Harkin Institute. Adam brings a policy and systems level lens to this conversation with expertise in food systems, environmental risk factors, and how conditions like water and soil quality shape long-term health outcomes, including cancer. And finally, thank you again to our expert, Mary Charlton here, who you've heard from tonight. Again, she's a professor of epidemiology at the University of Iowa College of Public Health and the director of the Iowa Cancer Registry. She is the brains and leads the work behind much of the cancer data used across our state and helps translate those numbers into a clearer picture of trends, gaps, and opportunities for prevention and early detection. So, without further ado, I would like to ask one question for everyone, and then I'm going to go kind of one by one. So out the gate, and we'll kind of go down the row here. When it comes to cancer in our community, from your perspective, what feels most urgent right now?
That's a very good question. I'm actually going to go for my paper because I'm a Baptist preacher and I'm liable to get all over the place. But we have actually heard some grim news tonight, you know, the information that we've had. But I think right now, letting people know that great strides have been made in cancer research and treatment, and that cancer doesn't automatically mean a death sentence. I think talking about it more in everyday spaces will help it not be such a hush-hush situation. Since Iowa is in cancer health crisis, maybe have representatives from the different health organizations be available to be speakers or vendors in places like PTA meetings or church events. Cancer doesn't care that it interrupts our lives, so we shouldn't feel bad if we need to talk about it on a sunny day at the beach with a pop-up cancer tent or Zone 3, which the information said Zone 3. Talk about health in spaces and places not normally associated with getting this information. Infomercials. Stand in the grocery store as an organization and hand out a flyer that just gives some information about where you can go. I just think cancer pops up and hits us everywhere. We need to pop up and hit back. I know in the high schools and stuff, parents would probably be upset if you went to their children with health information. But it doesn't mean you can't go to the parents with the health information, you know, with permission from the schools, with permission from churches. I just think I'm more of a, I don't have all the statistics and all the different things. Our group is more boots on the ground, and I think our boots on the ground is, I'm gonna hand you a flyer with some information on it. I hope that you do it. And then have some testimonies, living testimonies. Cancer killed my mother, but it didn't kill me because of the great strides that have been made. So I just think more of a boots on the ground. Let's chase cancer around the city.
Go ahead. Yeah.
So I am going to talk mostly about the environmental risk factors of cancer because of the Harkin Institute's partnership with Iowa Environmental Council on this report that's going to be coming out soon, and our partnership with Iowa Environmental Council and Iowa Farmers Union in hosting listening sessions around the state. And I guess in terms of which topic seems most urgent, I'll draw upon our experience with these listening sessions where we traveled around the state and spoke with people in Polk County, but in lots of smaller towns around the state too. And everywhere we went, we ran into people who had stories of many people in their communities who had gotten cancer. Dr. Charlton mentioned earlier, you can sort of do everything right and still get cancer. And we heard a lot of those stories of people who said that they did everything right, their family members did everything right, and nevertheless, many people in their community got cancer within a short span of time. And the thing that I guess I would highlight about that is I do feel like a lot of people felt like when it comes to talking about the environmental risk factor connection to cancer, I don't know if all of them feel like they necessarily have a great space to have those conversations. So that's why I was really excited to be part of that listening tour and events like tonight where people can have conversations where we cover the full range of topics about potential causes of cancer.
Fantastic, please.
A couple of things. One, we've never been talking about cancer as much as we have now, and part of that is really a response to Dr. Charlton's wonderful data collection, and not just data collection, but dissemination of the information. The data doesn't do any good just sitting in the computer with nobody doing anything about it. And ever since the Cancer in Iowa report a couple of years ago that highlighted cancer, Iowa being number 2 in incidence, there's been a lot of focus. The governor mentioned cancer 14 times in her State of the State address. That didn't happen 5 years ago. In addition to Iowa being number 2, I think maybe even more significant is it's almost the only state where the incidence is going up. Now, there is one other state where the incidence is going up, and it's kind of a statistical blurb. It's a state with a very low cancer incidence. It's Utah. And when you have a very low incidence, it doesn't take much to increase it. Some think that it may be the demographics of Utah have changed in the last 10 years. Used to be predominantly people who didn't smoke and drink, and now there's smokers and drinkers that have moved to Utah. But I don't want to belabor that, because their incidence, they're like 48th in the country. But we can't say that Iowa's the only one going up. But Iowa is going up, which bothers me even more than being number 2. One could say, well, somebody's got to be 1 and 2 and 3, but we are going up. Why are we going up? I would say we need to continue to do the research, and that's what everyone is saying. There was a time, maybe 60 years ago, where smoking would not have been listed as a major cause of cancer because the research hadn't been done. There may come a time when we also learn that some of the chemicals that we're exposed to are in fact contributing to not only being high, but going up. Dr. Charlton pointed out that the University of Iowa assembled a blue ribbon panel. One of the recommendations of the blue ribbon panel is to do more monitoring of air and water quality. At the same time, the state of Iowa is defunding the public monitoring of water quality. So that bothers me a lot. I would throw in one second issue that really wasn't highlighted, but is significant with patients I see, and that is the financial toxicity of going through a cancer journey. And that is getting worse. You can have great insurance provided by your employer. You may still have to pay $10,000 to $15,000 a year in copays and deductibles. And many of us are fortunate enough that we just write the check, but that bankrupts some people. And with the potential loss of the enhanced tax credits for the Affordable Care Act, there's going to be more and more people who are facing significant financial toxicity. And if you don't have insurance, you're not going to get screened for cancer. So the best cancer control is preventing the cancers we can prevent, cigarette tax, screening for cancer. Big shout out for more lung cancer screening. That's the screening that we're lowest at, and that's the screening that would save the most lives. Good cancer care. Fortunately, Iowa has a much better, is very good at taking care of cancer. Our mortality is much lower, and that's because we have a high incidence, but our mortality being lower is a testament to the good cancer care. And then also I'd say a shout out for continuing to provide care for survivors and those after their cancer.
Thank you. And Dr. Charlton, what's most urgent for you?
I think since the legislative session is starting, you know, we talked about how we're talking about cancer more than we ever have, but we were talking about it a lot last year too, and the year before, and almost nothing passes that's related to cancer-relevant legislation. So I would say, and I'll never forget, I went to a legislative breakfast to talk about alcohol and cancer, and what people were proposing. I remember one of the
elected officials there said, well, what you're saying makes a lot of sense. But when I go upstairs, things get complicated. And I took that to mean like a kind of a pat on the head, that's nice, but there's a lot of special interests out there that are very powerful. Now is the time. I know a lot of you are probably here and you're already loud with your elected officials, but now is the time to get about the loudest you can, because unless people's constituents speak up and really say what they want to have happen, it's so hard to overcome the special interests who are making money off of alcohol and tobacco and the other products that are causing cancer. So I would say right now it's very urgent that people contact their policymakers. And whatever your issue is, we presented a lot of options for things that you can focus on. Please be loud about what you think would help address cancer in your community.
Wow, thank you. An incredible amount of urgency, right, from so many different angles. I want to start here with Reverend Bryson. We saw earlier a lot of racial and ethnic disparity across zip codes in some of those maps, which were pretty startling. I think it was the black male prostate cancer rate variance that was perhaps most startling, where we saw just that huge difference across racial and ethnic groups. I think we know some of that gets at cancer prevention and early detection. So talk to us about what gets in the way of people engaging in cancer prevention, cancer screening, and early detection?
I think there's probably several reasons, maybe a lot of reasons, but I think there'd be fear in the known, but also a lot of fear in the unknown. People tend to think if I don't acknowledge a thing, unreasonably they think that thing cannot happen. If I don't think about it, if I don't address it, then that thing can't come to fruition. You can think the symptoms that I have not making me feel well, it can be brushed off with saying, oh, my age, or I'm getting the flu or a virus. Getting older, just a virus going around. And there's a lot of negative social, emotional, and spiritual thought associated with cancer in the Black community. What did I do to deserve this? So you keep secret about it or you don't even address it. I know coming up as a little girl, my mother would read the obituaries, and at that time, it told what a person died from. And it was almost like an ominous thing when she saw that they died from cancer. So I just think it's, how did I get this? Why did I deserve this? And so maybe I'm not even going to let you know that I have it. If I don't address it, I don't really have it. So I think for the Black community, what we find in our cancer support group, we have a hard time getting women to come because they don't want to talk about the fears. They don't want to talk about maybe they need more help. So I just think for the Black community, and that's all I can speak for, is just the fear of the unknown. If I don't talk about it, I don't have to address it, I don't have to get well. And then sometimes by then it's too late. So I just think having the connection with our group, we go one-on-one with people once we identify them. We don't push into their space. We don't have a lot in our group, but we kind of stretch ourselves thin to show up for people to walk them through their whole journey. So I think just letting people know, because I know at first, when I first started talking about it, I yapped about it everywhere. And then when I found out some of my friends had cancer, they never said anything. It made me think, am I talking about it too much? But that is my purpose, to let people know I survived. And my doctor had even put on my outcome in the very beginning, she will live. So people need to know that and not be afraid. March 30th, it'll be 14 years. And I am glad to talk about it, to let people know.
That's amazing. Thank you. I think your insights remind us that as we're working on steps moving forward, it's not a one-size-fits-all approach, right? We need to come to communities where they are and make sure we're tailoring our cancer prevention strategies appropriately. Thank you. Adam, talk to us a little bit about the policy levers related to cancer prevention and outcomes that you might see as maybe underused or as having potential here in Polk County.
Yeah, so I mentioned earlier I'm coming at it from the environmental risk factors perspective, and there was quite a bit of media attention on that topic. So the Washington Post wrote an amazing story a few weeks ago about how cancer rates in the six states that raised the most corn were higher in people under the age of 45, and it was centered on Iowa. Bloomberg has written an article about cleaning up Iowa's water. The Guardian has written several posts or several stories about it. So Iowa's been getting quite a lot of attention. I also want to mention there's a reporter in the audience today, Annika Jane Beamer, who's collecting personal stories. So, again, connecting to this idea of people who want to share their personal story, you can connect with Annika if you want to talk more about that. But anyways, there's been a tremendous amount of attention nationally on this issue. And I've sometimes heard people say that they think actually the environmental risk factors are getting too much attention. And so I want to disagree with that a little bit and suggest that maybe we're looking at the wrong metric, because what's important is not whether there are news stories being, covering certain topics or whether there are events being held, but rather whether our elected officials and the decision makers in the state are taking concrete actions to address the issue. And I think on environmental risk factors, that's not really happening. I would also say that you sometimes hear this idea, you sometimes hear the point, and I think it's been illustrated very nicely, that cancer has no one single cause. It's very complicated. And I think when you're talking about environmental risks, and you can say, we don't understand everything there is to know about the environmental risk factors and how that connects to cancer in Iowa, I think that should be the starting point of a conversation rather than a way of ending a conversation. And what I mean by that is sometimes it's said, well, it's complicated, we don't know how it works, so let's not talk about it. But to me, it seems like if you think that environmental risk factors might be playing a role and you care deeply about it, what that suggests is you should be doing everything you possibly can to better understand the problem. And so a few policy suggestions that I'll make in relation to that comment. I'm glad to hear that the Blue Ribbon panel agrees with me on at least one of them, which is, I think one obvious no-brainer thing is that we should be funding the state water quality monitoring network. It seems like something that if we're worried about nitrates in drinking water, which we should be, we want to be making sure that we're getting the best data that we can. But there's also a lot of other policy solutions that relate to that idea of getting as much information as we can. So one thing that kind of blew my mind is that people in Iowa, if you own concentrated animal feeding operations, you have to have a manure management plan. But what's funny about it is they have these plans, and those plans just sit in county offices, and they're not really easily accessible to the public, and there's not really an easy way for people to check whether this manure from different concentrated animal feeding operations are all being spread on the same field. And of course, we know that any given field should only get one application of manure for a certain time period rather than getting multiple ones. So that, to me, is another very straightforward place where if we're trying to get more information, we should have a system where there's a geospatial database that maps where manure is being applied, where we have a very precise understanding of where animal waste is going and where fertilizers and pesticides are going so that we can better understand the problem. So I feel like I've been going for a while, so I'll stop there, but thanks.
That's great. No, I'm sure there are follow-up questions in people's heads, so keep those ready. Thank you, Adam. That's great. Dr. Deming, you've got an audience here. I'm sure there's some clinicians, but most of us non-clinicians. What do non-clinical partners most often misunderstand about cancer diagnoses and survivorship from your seat?
Good, I get to talk about human beings. I'm a scientist, but really I am someone who's involved with caring for people. I kind of upset that medical schools haven't adapted more. I know so many people who would be great doctors, but they can't get through organic chemistry their second year of pre-med, and they're sort of, and I say that because I think the humanities are great training for being a doctor, not being a PhD doing research, but for those doctors like me that care for individuals. So one of the obstacles is the communication. Not only is the cause of cancer complex, but the workup and the treatment of cancer is very complex, and so much jargon. And if you don't have the benefit of having a care team of doctors or nurses and that can explain things, it's very difficult to grasp what's going to happen. So that's one of the obstacles for caregivers. I would say second is just also understanding the concept that not everyone can be cured, but everyone can be healed. And I think many individuals going into the cancer journey are so focused on the fight, and that this is a fight to win, a fight to the end. And there are many people who have stage 4 cancer that is very treatable but not curable, who probably don't know that they're actually in that category. And this understanding of the uncertainty of the future, and that going from being cured to having incurable cancer can be one CAT scan. So that uncertainty and that will to not just survive, but the will to beat cancer doesn't always align with the biology of cancer as a chronic disease. And the last thing I would say is that cancer is a family disease. Maybe only one person has the cancer, but the whole family is going through the cancer journey. There are significant stress, anxiety, depression that happens not just with the individual going through cancer treatment, but with the family and the financial and the way it just can disrupt the whole flow of the family. And then finally, I will say that many think that when the last treatment is done and you ring the bell, that it's over with. The treatment of cancer causes significant late toxicity that can go on for a long time, long after many of the patients are sort of discharged from the cancer center, because the cancer center is appropriately focusing on treating the cancer. And so many of the cancer survivors that get their really serious late effects years after the cancer treatment are not surrounded by the same support as those that are starting the cancer journey.
Thank you for that perspective. Dr. Charlton, being our data guru up here, you gave us some great policy and other ideas. Any other thoughts for how those of us in the room and local leaders can make sure we're using cancer data moving forward to inform our data and investments, or other ways to make sure that we're thinking about the data?
Yeah, thank you for that question. It's an opportunity for me to highlight. We have so many data tools that we've created that are out on our Iowa Cancer Registry website. They are meant, again, to empower those of you who are advocates or who are researchers or providers to use that data. We collect, again, hundreds of variables on theoretically 100% of the cancers diagnosed in Iowa. And we collect that data so it is there for you to use. And we try to use it to its fullest extent possible to let people know that it's out there through opportunities like this. We hope that people will use it. Go look at the Iowa Cancer Plan for ideas in terms of policies and programs. We hope that they'll reach out so that we can help them either through the Cancer Consortium or the Cancer Registry, or connect them with partners. And we hope that people continue to talk about cancer. It's so, for all the reasons that people have mentioned, it's so important, and agree with everybody. Like, now is the time for more data, not less. So we really need to be collecting that to really empower researchers to be able to look at some of the questions that are on the top of people's minds.
Wonderful, thank you. We're going to dive in now to a few questions from those of you in the audience. Thank you. I think something that's getting a lot of attention lately is radon. We know if you look at the radon risk map, the whole state of Iowa is just bright red compared to the other states in the nation. Given the amount of radon in the state, what should Polk County residents do, and should Iowans get screened for lung cancer even if they haven't or don't smoke? This is just going out to the panel, so please jump in as you would like.
Let me answer one part of that as a clinician who orders lung cancer screening. Right now, insurance won't pay for lung cancer screening if you don't have a significant smoking history. So even though we know that radon is the second leading cause of lung cancer, it's not a criteria by which we currently can order a lung cancer screening CAT scan. So there's some public policy work that could be done there in Iowa to change the criteria by which individuals could have lung cancer screening. I'll answer the other part as well. Testing for radon is very, very inexpensive. It's less than $20 to test. Mitigating can be more expensive, but first-step test, over 70% of homes in Iowa have a higher level of radon than EPA recommends. Now, frankly, there's no safe amount of radon, and the level that's sort of listed as safe, we don't really know it's safe, but it's a starting point. So testing your home for radon is a very inexpensive thing to do. Mitigating can be more expensive, $1,500 to $3,000. Getting radon mitigation if you're building a new home is fairly inexpensive. We need to also continue to look at public policy that has carrots and sticks to get more radon work done. 2 years ago, or maybe 3 years ago, 2022, we passed the Gail Orcutt School Safety Radon Bill, and it was to require public schools to test and mitigate for radon. And that was one small step, but we've got other steps we can do with public policy.
Absolutely. Anything else anybody wants to add? Okay. I think there's a lot of appetite and interest in early screening and detection, and rightly so, given what we've heard tonight. I'll start with you, Reverend. Talk a little bit about opportunities you see for more community-based screening or more community-based support. What are some of the kind of considerations we should make if we're thinking about trying to do more of this in a community-based way?
I think it's kind of like what you said earlier, just being out at more events, being more aware of the events going on in the community. I know Black Women for Healthy Living, we try to hit wherever we're invited, if we have, enough members to man our table. And so we try to put out information not only about breast cancer, which is a lot of our focus, but about all the cancers. And then if we can link it up with someone that they can talk to. But I just think being open to, like on the news, they might give Beaverdale Fest is there, or I think just keeping our eyes open for places that we can be, and maybe even having a pool of volunteers. Maybe you can't do it because you don't have volunteers, but maybe if there was a pool of community volunteers that could be called upon, like for Juneteenth or for just any Hispanic festivals, just anything that people could get to, that they could get the information. I just think keeping our eyes open and being able to work together across all the lines, help each other.
Absolutely, thank you. This question is kind of straight to the point, but feel free to kind of fill in some ancillary details. Adam, should we all get nitrate quality water filters at home? I know it's a pointed and tough one, but folks are really thinking about nitrates and wondering about what they should do in their own homes.
Yeah, I get that question a lot. I'm sure Dr. Deming probably does as well. But I mean, I think there are different levels of risk tolerance that people have, and I think it's important to know that Des Moines Water Works does a really great job of keeping the water under the 10 milligrams per liter level of nitrates, and they're a really impressive or outfit for doing that. I personally, for my kind of, balancing of risk assessment, I do think that because there's been several studies that have suggested that nitrate levels below 10 milligrams per liter are associated with cancer. Stay tuned for our report with Iowa Environmental Council for more on that. I personally think that, I prefer to have water that has gone through reverse osmosis, which is the process that is needed to remove nitrates. But, getting reverse osmosis machines might not be an affordable option for many people. I do think there are other ways of doing it. So, what I do is I just refill jugs at the local Hy-Vee and, they sell water that's treated by reverse osmosis. So I do think there are options, and my own personal risk assessment would be that it's safer to drink water that has been treated to take out all the nitrates. And so I would recommend that if it's an option for people.
Awesome. Thank you for your perspective. It's, I think, a good reminder, again, that it's personal level of risk tolerance and that there's so many different factors at play, and those are individual decisions that are hard. But that we should do what we can to make sure we're hitting at the policy levels when possible, right? Mary, I want to send this to you. Is vaping considered smoking in the data? And I wondered if you would just share a little bit more related to what you know about accessing vaping-related data and how we could potentially think about that as a precursor to tobacco use, et cetera.
Phone a friend in the audience. We have an expert out there. No, the vaping information is not in the data that I showed for smoking rates. We have talked about adding that and trying to get an updated estimate on vaping. It does not confer the same risk to cancer as combustible smoking cigarettes. However, again, like I mentioned earlier, it's just one of many products that can get our youth and others addicted to nicotine. So it's something very important. We hope to try to incorporate that into our slides, but it's just a little bit harder to interpret what the risk is from vaping itself. But I think the tobacco industry viewpoint of it, and some others, would be that it's a safer way to consume nicotine, and it beats the alternative of smoking cigarettes. I think the other side, again, of that argument is it gets people addicted, and people who would have never progressed onto smoking cigarettes, it gets them to do so. So it's, I think it's highly problematic in terms of, and again, cigarettes are a product that they'll tell you, if used as directed, it will kill 50% of the people who use it. So they have to constantly replace their customer base with younger people to consume those products. So all very concerning, and something definitely to keep an eye on as there's more research about the impact of vaping and those other products on cancer.
Wonderful, thank you. I do also want to make a note on that topic that one of the most valuable sources of data we had related to vaping and other youth-related behaviors was from the Iowa Youth Survey, which was conducted by Iowa HHS in partnership with schools. Unfortunately, due to a legislative change that required changes in the way schools receive and accept parental consent, most, if not the vast majority or all schools have declined and are no longer providing that survey into their schools, which has shut off our line of sight into that data dramatically. So I can tell you in Polk County, we have no schools this fall who participated in the Iowa Youth Survey, and I have no data as a health department to use for this year to plan related to sexual behaviors, behavioral health, bullying, smoking, vaping, you name it. So when we think about policy levers and the opportunity during legislative session, that is another ripe one where, unfortunately, we've lost our best line of sight into what's happening with our teens by doing away with that data collection. So a reminder again that without the data, it's hard to do much, but when we do have that data and that shared collective understanding, we have the opportunity to make changes. So I am going to ask one final question of all the panelists along the row as we kind of finish up and conclude here. And they haven't received this one in advance, I don't think, so it's putting them on the spot. But I would like if you would all share one thing that you would advise us, either as individuals, as community members, that we should do and think about as we're leaving here tonight. I think everybody probably entered this space the same as me, where you expected to come and see daunting data that's overwhelming and a little bit sad, right? But you also came because you want to be part of what's next. And so what we're going to ask you to do in a few minutes at the closing of this panel is to follow another QR code and to take a survey to let us know how you want to continue to engage with us. We're really interested in future work here, and I'll talk more about that in a moment, but I really would love to use the expertise up here on stage first. Let us know what you think we should do, what steps we can take to move forward from here today. Again, as individuals, as a community, as a county, whatever makes sense for you.
Okay. And I think in order for me to answer this question, I'm going to read Black Women for Healthy Living's mission statement. And it says, Black Women for Healthy Living is a Christian-led nonprofit organization that addresses health disparities of Black women in the greater Des Moines area. We advocate, empower, and provide hope to Black women through education, support, and resources. So I just think knowing your mission statement, what is your purpose for even showing up tonight? What is the mission statement for your group? And can your mission help my mission? Are we free to come to you and ask for help? But hearing the different mission statements, the different things that people have to offer, are we free to go to each other to ask for help? Or if you think about an organization, to go to them. So I think collaboration is just knowing what each other does and being able to ask for help or think of your partners, oh, perhaps they would be interested in this. So I just think opening up doors of communication, reaching back and forward, but I just think knowing your purpose, what is your purpose, and are you sticking to your purpose? Everyone doing the reasonable service, I think everything can get covered.
I love that, thank you. And it's a good reminder of our display in the hallway out back, which shows many of the really cool things going on in Polk County. So make sure you're taking photos and that you're following up, because I agree with you. There's nobody or no organization in this room who's gonna say no right now to you reaching out and saying, can I partner? Do you wanna talk about the cancer stuff? So that's great, thank you. Adam.
All right, so at the end of the last question, afterwards, I was like, oh, I should have said this one thing. Unfortunately, your question was open-ended enough that I can include that now. So I said last time that, this nitrate level is something that everyone has to balance their own, kind of risk tolerance with the costs and benefits. But I actually think that it should be something that we should entrust our government with being able to give us reliable information that we can trust. And I think when it comes to the 10 milligrams per liter limit on nitrates, the reality is that limit was set based on blue baby syndrome, and it really wasn't set at all in connection to cancer. And this is something that's spanned across across administrations, both parties, have not really examined that limit in respect to cancer, or at least have not come out with any public findings. So I think that that's something that we should have enough trust in our public institutions, and we should have trustworthy public institutions where people don't have to make those decisions themselves about should I get a filter or not. Along those lines, I guess what I would suggest to people is there are a couple reports that are going to be coming out in the next few weeks that I'm really excited about, that are going to have some policy recommendations. So I just want to encourage people to take a look at those policy recommendations. One of them is going to be with the Iowa Environmental Council, the report about environmental risk factors in cancer. Another set of policy recommendations comes from John Norris, who, after the Central Iowa Source Water Resource Assessment, convened a bunch of experts to talk about how Iowa can address its water quality issues, and came up with a really great set of recommendations. So I'll just kind of put those out there as things for people to keep an eye out for. Also, as Craig mentioned, please come to the Harkin on Wellness Symposium on actually March 11th. We're going to have a speaker there. Dean Ornish is going to be there talking about lifestyle and cancer. And Jesse Bell is going to be speaking about his research looking at nitrates in drinking water. So thanks.
Thank you. Yeah, Dr. Deming.
Two recommendations, one personal and sort of from the medical perspective for your own personal health. I'm a cancer doctor, but I think the most important doctors are primary care doctors. Having a primary care doctor that you trust, that you know, that has your back, that is an important part of your health. You don't have to memorize what's the schedule for pap smears, what's the schedule for mammograms, what's the schedules for colonoscopy. You don't have to memorize what your schedules for immunizations. You know, a good primary care doctor with modern electronic medical records is going to be your advocate, your partner, and if you don't have a primary care doctor that you really click with, seek out a different one. It's really important for your own personal health, including cancer prevention and screening. And the second would be continue to be involved in public policy advocacy. If you don't know how to do that, give a shout out to the American Cancer Society Cancer Action Network. That's the advocacy arm of the American Cancer Society. We take cancer survivors and anyone interested up to the state capitol here in Des Moines. Once a year, we head out to Washington, D.C. If you're new at it, will teach you how to use your story to help persuade legislators to do good public policy. So have a good individual doctor, but stay involved in public policy advocacy.
Close us out, Dr. Charlton.
I think I also have two recommendations, and the first is just go out and Google Iowa Cancer Plan. Just look at it. It's just set up in the most beautiful way. It's such a comprehensive look at the different risk factors and things that we can be doing in Iowa. You don't have to think, you don't have to make it up for yourself. You don't have to reinvent the wheel. It's already been done by experts across the state. Both Dr. Deming and I are on the board of directors for that. We can attest to how wonderful that plan is. So please familiarize yourself with that. And the second is, if you're familiar with like an abundance versus a scarcity mindset, I prefer to think of things as an abundance mindset. The more we talk about cancer and the more we talk about all the risk factors for cancer, the more energy there is to do something about cancer, rather than a scarcity mindset that we have to just pick one thing and there's only enough energy in the room for one thing. We need to do things about all the things. We need to keep all the conversations open and really go about it with an abundance mindset that the more we talk about it and the more we do, the better it's going to get for everybody. And all of our, plug in your favorite cause, whatever it is, it's going to bring more energy to that, to keep cancer at the forefront of conversations and to keep those conversations open.
Fantastic. Thank you so much. A round of applause for our panelists, please. All right, excuse me. Feel free to stay for just one moment while I close this out. Is there another slide with the other QR code, though? That's what I'm looking for. There we go, okay. Thank you, especially those who came out on a Tuesday in January. I don't know what we were thinking, but thank you. I do think it's a good timing in terms of legislative session is gearing up and there's some work to be done here. I hope you all felt what I felt, which was a feeling of kinship here, of folks who are coming together, concerned, and really wanting something different, expecting something different for Polk County. The last thing we want to do here is provide an opportunity to continue to engage with us moving forward. The Polk County Health Department and Des Moines University, other folks in this room, intend to put together some sort of Polk County Cancer Prevention Coalition so that we can do a little bit of more thoughtful planning together. There's a tremendous amount going on. We heard just a little bit about that. And we'd like to work together to do a bit of an environmental assessment and a gap analysis and really come up with what are Polk County's priorities on cancer prevention. How do we choose a set of those that we can all be rowing towards in the same direction? Because our efforts are needed. We need to align them. We need to make sure that we agree and can kind of come to some level of consensus on where we prioritize our time and energy because the need is so great. So please, if you're interested at all in continuing this conversation, follow that QR code. It's going to give you some options for ways to engage with us. Do you just want to hear an email every 6 months? That's cool. Or do you actually want to come in and join a task force, work with us on creating strategies and objectives? Whatever level of engagement works for you works for us. But we are very committed here at the Polk County Health Department to make sure that this is the beginning of the conversation and that we continue to uplift everything that's already happening so that we can make a different Polk County. Thank you all for being here. Have a safe drive home.